10 ways to stop a panic attack before things get out of hand. 1. Seek counseling. Cognitive behavioral therapy, CBT, and other types of counseling can often help people who have panic attacks and who have panic disorders. CBT aims to help you change the way you see challenging or frightening situations and to help you find new ways to approach these challenges as they arise. You can find CBT for individuals or groups, online or face-to-face, and the length of treatment can also vary. In exposure-based CBT, your therapist will expose you to something that can trigger a panic attack and help you work your way through it. As well as changing behavior, there is some evidence that CBT might affect structures in your brain that are responsible for panic symptoms. In 2018, some researchers' trusted source found evidence that people who attended 4 weekly sessions of exposure-based CBT experienced changes in the neural pathways involved in panic symptoms. However, this was an early study, and more research is needed. In 2018, 37 people in Korea attended a mindfulness-based program once a week for 4 weeks to see if brief treatment would help reduce symptoms of panic disorder. One aspect of the treatment was to focus on their heart rate, as some people experience cardiovascular symptoms during a panic attack. The findings suggested that the participants could better manage their symptoms using their own thought processes after the treatment. However, this was a small study, and there was no control group. More research is needed to find out how effective short-term therapy can be. 2. Take medications. Benzodiazepines, such as alprazolam, Xanax, can help treat the symptoms of panic when they occur. However, they won't help treat an underlying anxiety disorder and can quickly lead to dependence. For this reason, doctors only recommend them for short-term use during a crisis. Because benzodiazepines are a prescription medication, you'll likely need a panic disorder diagnosis to have the medication on hand. In some cases, a doctor may prescribe antidepressants for long-term use. Examples include selective serotonin reuptake inhibitors, SSRIs, such as escitalopram, Lexapro, or fluoxetine, Prozac. Serotonin norepinephrine reuptake inhibitors, SNRIs, such as duloxetine, Cymbalta. Anti-anxiety drugs, for instance, azapirone, buspirone. Some anti-seizure medications, such as pregabalin or clonazepam, can also help treat anxiety. Which drugs can treat anxiety disorder? 3. Use deep breathing. While hyperventilating is a symptom of panic attacks that can increase fear, deep breathing can reduce symptoms of panic during an attack. In one study trusted source, published in 2017, 40 people joined either a therapy group that involved deep or diaphragmatic breathing or a control group. After 20 intensive training sessions, those who practiced deep breathing saw improvements in their attention levels and emotional well-being. Blood tests also showed lower cortisol levels in this group, suggesting lower levels of stress. The participants did not have panic disorders, but the strategies could help people who have panic attacks. Another group of scientists' trusted source found that slow breathing could have similar effects. They suggested it could also improve feelings of relaxation, comfort, and alertness, and reduce symptoms of arousal anxiety, depression, anger, and confusion. If you're able to control your breathing, you're less likely to experience the hyperventilating that can make other symptoms, and the panic attack itself, worse. Focus on taking a deep breath in through your nose, feeling the air slowly fill your chest and belly. Then slowly exhale through your mouth and feel the air leave your body. Breathe in through your nose for a count of 4. Hold for a second, and then breathe out through your nose for a count of 4. 4. Recognize that you're having a panic attack. By recognizing that you're having a panic attack instead of a heart attack, you can remind yourself that this is temporary, it will pass, and that you're okay. Take away the fear that you may be dying or that impending doom is looming, both symptoms of panic attacks. This can allow you to focus on other techniques to reduce your symptoms. It is not always possible to avoid triggers for a panic attack, but if you know what triggers it, this can help you understand that it is a panic attack and not something else. 5. Close your eyes. Some panic attacks come from triggers that overwhelm you. If you're in a fast-paced environment with a lot of stimuli, This can feed your panic attack. To reduce the stimuli, close your eyes during your panic attack. This can block out any extra stimuli and make it easier to focus under breathing. 6. Practice mindfulness. Mindfulness can help ground you in the reality of what's around you. Since panic attacks can cause a feeling of detachment or separation from reality, this can combat your panic attack as it's approaching or actually happening. Mindfulness involves focusing your attention on the present, recognizing the emotional state you're in, meditating to reduce stress and help you relax. Experts say that mindfulness strategies, such as meditation, can help manage anxiety symptoms, although it's not clear they can treat an underlying anxiety disorder. American family physicians recommended mindfulness as a strategy for dealing with panic and anxiety in 2015, saying it can be as helpful for reducing stress as CBT and other behavioral therapies. Some research-trusted source has suggested that mindfulness-based cognitive therapy could help people with anxiety disorders who are receiving medical treatment but haven't found drug treatment helpful. 7. Find a focus object. Some people find it helpful to find something to focus all their attention on during a panic attack. Pick one object in clear sight and consciously note everything about it possible. For example, you may notice how the hand on the clock jerks when it ticks and that it's slightly lopsided. Describe the patterns, color, shapes, and size of the object to yourself. Focus all your energy on this object, and your panic symptoms may subside. 8. Use muscle relaxation techniques. Muscle tension is a symptom of anxiety, and muscle relaxation techniques can help reduce tension and promote relaxation during an attack. Progressive muscle relaxation aims to release tension in one group of muscles at a time to relax the whole body. Much like deep breathing, muscle relaxation techniques can help stop your panic attack in its tracks by controlling your body's response as much as possible. If you attend muscle relaxation therapy, your therapist might take you through the following steps. Trusted source. First, you may learn how to tense the muscles before releasing the tension. Then, you will learn how to relax the muscles without tensing them first. You may also learn how to relax specific sets of muscles, for example, in the shoulders, for practical use in everyday situations. Finally, you may learn how to practice rapid relaxation, when you can identify any areas of tension and release it as needed. 9. Picture your happy place. Guided imagery techniques can help reduce stress and anxiety. Research trusted source suggests that both spending time in nature and visualizing nature can help treat and manage anxiety. What's the most relaxing place in the world that you can think of? A sunny beach with gently rolling waves, a cabin in the mountains. Picture yourself there and try to focus on the details as much as possible. Imagine digging your toes into the warm sand or smelling the sharp scent of pine trees. Here, learn about 5 visualization techniques that can help you meditate. 10. Engage in light exercise. Research shows that regular exercise can not only keep the body healthy, but boost mental well-being too. Experts have found that exercising at 60 to 90% of your maximum heart rate for 20 minutes 3 times per week can help reduce anxiety. If you are not used to exercising, talk with your doctor before starting. There is some evidence-trusted source that starting aerobic exercise anew can trigger additional anxiety in people with an anxiety disorder. Building up gradually can help your body adjust and avoid breathing problems. Aerobic exercise includes activities such as running on a treadmill. What do you think of our video? Let me know in the comment section below. Before you go, please hit the like button and subscribe to my channel. Thanks for watching.